Hey, you guys, welcome back for another week of topics and tips. As promised, this week we are covering SSRIs and MAOIs. Now, I've been covering a little bit more of our farm stuff because as I navigate through all of these diagnoses and give you a better understanding, and we talk about these drug classes for the treatment options, I just wanted to give you some more foundation on those farm things that we are covering, just so that as you see these medications, you can group those drug classes together, know the mechanism of action, and quickly identify and group them. So even if you see a medication that you're not so familiar with, when you have this foundation of knowledge and you see those drug endings, you'll group it together and know how they work and be able to navigate a little bit easier. Okay. So, as always, with the introduction, I like to say, welcome back to all of my people who have been supporting and following me on this journey. I appreciate you guys, and I hope that you found the material helpful. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio, where I have designed this to help nurses and nurse practitioners to be successful on certifying boards, but also in practice. But the disclaimer to this is please don't use these for sole treatment options because you know we work in a patient by patient basis, okay? But let's get into the material. SSRIs. You hear about it all the time. You know, it's the most commonly prescribed antidepressant right now. But what is an SSRI? An SSRI stands for selective serotonin uptake inhibitors, right? So we know that neurotransmitter serotonin really helps with the mood. So this medication is used to increase those levels. It can be used to treat many things like our major depressive disorder, bipolar depression, generalized anxiety, PTSD, social anxiety, and so much more. Okay. But let's talk about it. So, what is serotonin? And I was just hitting on it a little bit, but let's get into it a little bit deeper. So, you know, we have neurotransmitters, we have various ones, and you know, neurotransmitters work in our brain to send signals throughout the body, right? So, serotonin is one of those chemical effects of those of the neurotransmitter, where it's sending those chemicals throughout the body, and it plays that key role with like our mood, our digestive system, our sleep, etc. So we need to make sure that that is adequately regulated so all of those functions are operating at its best, right? So the mechanism of action for these SSRIs is to increase the serotonin levels as there is a deficit, okay? So when we start to have all of these mood disturbances and things of that nature, the serotonin levels are typically low. So we initiate our SSRIs, those selective serotonin reuptake inhibitors, to increase in the areas that is deficient so that these neurotransmitters can adequately transmit and we can regulate our moods, our sleep cycles, our digestive system, etc. So I wanted to group this together a little bit just to go over some key notes that I want y'all to know about SSRIs. All right. Especially noting that they are most commonly used. One, I want you to be able to know those medicines when you see them and being able to identify them. So SSRI in an ene, I-N-E. So fluoxetine, which is also known as Prozac, sertraline, which is also known as Zoloft, and paroxetine, which is also known as Paxil. Now, sertraline is one that is also commonly used for the elderly population and is safely used in that population. Prozac, we do not use in our elderly population. One thing that I want you to really be cautious of, and especially with that one, is because, you know, SSRIs can have that anticholinergic effect. You know, we talked about that last week with those anticholinergic, you know, it just dries everything up, right? So they have the dry mouth, the dry eyes, urination may be limited, they may be constipated, things of that nature. So, you know, in the elderly population where things are kind of slowing down, we don't like to give them anything to make it any more slower, right? So Prozac is one of those ones we're not trying to give to our elderly population, and remembering those ones that are good. So our citalopram, our sertraline, also known as Zoloft, those are more friendly with our elderly population. Next, Things that are contraindicated with our SSRIs. MAOIs are contraindicated in our SSRIs, right? And we'll talk about those MAOIs in just a second. But also other medications that are utilized to increase your serotonin levels because, hey, if our SSRIs are already increasing it, we don't need anything else doing the same, right? Because that can lead us into that serotonin syndrome. Um, that is what the next little note is about because serotonin syndrome is when our levels of serotonin are way too high in the body. It can cause you to have symptoms like like diarrhea, even constipation, because this works on our digestive system. So it can alter that if it's too high. You can have some shivering, muscle rigidity. You may have seizures, and if it's left untreated, it can be fatal. So we want to stay on top of this, making sure that we are not um, having patients in too high of a level of serotonin. So it's contraindicated in things that may also increase those levels. Okay. So want to be sure that watching the elderly population, remembering which ones we do not give and which ones work particularly better, being able to identify those medications, understanding the things that is contraindicated, and also being sure to watch out for that serotonin syndrome. No, I know I just gave you a lot pretty quickly. So, I like to kind of recap, right? So let's hit it from the top. SSRIs, also known as our selective serotonin reuptake inhibitors, are the most commonly prescribed antidepressant, right? Ending in ene, I-N-E. And these medications are utilized to increase those serotonin levels to help and aid in the mood, sleep, digestion, so those neurotransmitters can work effectively so that the mood is stabilized, your sleep cycle is stabilized, etc. Right? It can give you that anticholinergic effect of drying things out, so you want to be cautious in those areas. Also, watching our elderly population and remembering not to give them Prozac, right? Um, Remember that they do well with our citalopram, our sertraline. Those are more the friendly elderly SSRIs. Also, remembering those contraindications, we're not trying to give them any other medications that work the same with increasing that serotonin level because serotonin syndrome is a critical factor that can be fatal if left untreated. Remembering that is when there are too high levels of serotonin in the body, and it can present with patients having digestive issues like diarrhea, constipation, any shivering, seizures, muscle rigidity, various things that can be affected from this. So just paying attention to those factors, but familiarizing yourself because again, it is the most commonly prescribed. Okay, but I want to give you that, and then we'll get in our MAOIs. All right, MAOIs. So, what is an MAOI? That is a monoamine oxidase inhibitor, also an antidepressant, but not as commonly used as SSRIs. They're still utilized, but this is an older medication that used to be used a little bit more frequently, but I like to hit on this. Now, the mechanism of action of this one is similar but different because it works in the fashion of blocking that enzyme monoamine oxidase. And you're probably like, what, Brittany? But monoamine oxidase enzyme it works in a fashion of breaking down various neurotransmitters like your neuroepinephrine, your dopamine, your tyramine, your serotonin neurotransmitters. So if it's doing that and breaking those down, then what is going to happen? You're going to have alterations in those levels in your body, correct? So, as we're talking about these serotonin levels and regulating mood and sleep cycles, etc., for antidepressant purposes, you want something that's going to give us the alternative. So, as this is a monoamine oxidase inhibitor, and I know this is a mouthful, but it's doing what? It's inhibiting that enzyme from blocking these neurotransmitters. Get what I'm saying? So, again, if the monoamine oxidase enzyme is working to break down the neurotransmitters, then this MAOI is working in the fashion of inhibiting it from breaking it down. So it's blocking the enzyme so that it cannot break down those neurotransmitters, which in turn allows the levels to be where they need to be and increase to the level so that they can regulate and function as they should. Okay. Now, you want to make sure that you know this for your patients and how you prescribe, but making sure you're educating them because, sometimes they get in here, they take the medicine, they're coming back to you and they're like, hey, this is not working. I'm not feeling any difference. But making sure, like what is common with many antidepressants, that you may not see any effectiveness for about 2 to 3 weeks. Okay. So you definitely need to give it about 2 to 3 weeks to start to see some changes. But the most benefit is gained after taking this one for 6 months. Okay. So you keep this in the back of the mind, in your mind, as you are prescribing and treating for your patients, but also be sure to educate them so that they know this as well, so that they know how and what to expect. Okay. So contraindications for this one as well is your SSRI, like other medicines that may increase the serotonin levels for that various reason. I have listed medications for this one. These do not have a consistent ending, so to speak, with remembering these. I often like to tell y'all to know your Marplan, your Nardil, and your Parnate, right? For your MAOIs. Now, one big thing with the MAOIs that I like to talk about also is that tyramine breakdown, right? Because with this, you have to be cautious of what you are intaking, all the way down to the foods. And I always say this because y'all probably hear me when I talk about meds farm. When I was in undergrad for my bachelor's in nursing, I gained so much. I love my pharmacology teacher. She taught on the level on how I learn, and that's the mnemonics, the songs, the dances, all that stuff. So she used to say, MAOI, I can't have my pizza pie, right? And it's like, so what does that really mean? So with MAOI, you can't have your pizza pie because when you think of a pizza, you think about what's on it. Okay, so with this, you're not supposed to have those aged meats, those aged cheeses. So, on the pizza, you're going to have your cheese, you're going to have your pepperoni and things of that nature. So think of that when you're remembering the things that you don't want to have. You don't want to have alcohol. So, they may have a beer with their pizza. So just, that's how she taught us to remember. And it's always stuck with me, but I like to throw that out there to help you guys with your studying as well. But what happens is, because when you alter that and consume those things, with the tyramine, what happens is you have an increase, it causes an increased blood pressure level and puts you into a hypertensive crisis, which is also a fatal response. So this is on the end of the MAOIs, just like the serotonin syndrome, okay? So you want to make sure that you're educating them on what to consume and what not to consume, okay? All right, you guys, that is my short and sweet fashion of the SSRIs and the MAOIs for this week. But also make sure that you meet me back here for Work It Out Wednesday as we work through practice questions to test our knowledge on this. We also will be doing soap notes to kind of go through this so you can kind of see how this may present itself in a fashion and how you would document a soap note as you work through it. I'm about to be giving y'all so much more with this to help you retain each week, okay? But as always, you guys, thank you for watching. But be sure that you like, comment, subscribe, and share with a colleague, friend, or anyone that you think that may find this helpful as well. And be sure to meet me back here next week. Bye, y'all.